Our guest today is the President and Chief Executive Officer of Presence Health. Presence Health is the second largest healthcare system in Illinois. She oversees more than 150 locations, including 12 hospitals and 27 long-term care and senior residential facilities. Our guest today reports to a board of trustees, which consists of 5 orders of Catholic nuns. One of the nuns, I know, Sisters of Mercy, St. Patrick's and McHenry, but for that, I may be at Cook County Jail. One of the nuns is Sister Clara Francis, who delivered today's invocation. Let's give her another round of applause. She's devoting her life to serving humanity. Crain's Chicago Business named our guest today one of the 20 most powerful women in business in 2014. Under the Affordable Care Act, the United States is undergoing a fundamental and intensely challenging change in how health care is delivered. Our guest today is at the forefront of healthcare transformation. Ladies and gentlemen, Sandra Bruce. Sandra?
Okay, well, Jay told me just to have a good time up here. And one of the things that would make me really happy is to know whether my husband showed up. Okay. Oh, all right, okay. Yeah. So welcome, my husband. When I mentioned on the way up this morning that I'd see him here for lunch, he said, "This is typical male." What? No one told me about it. So I come and yell at my executive assistant, who says I've been telling him for years. So thank you all so much for coming. Many of the people I care so much about are here today. Supporters from all over Presence Health, foundation board members, community board members who serve with no pay, no compensation, and we always say just for the glory of it, you're going to get your rewards in heaven. They help make these institutions so fine. So I thank all of you for being here today. Today I want to do a couple of things. I'm going to give you just a brief review of who Presence Health is. Jay told you a little bit about us. We've been around for a long time. Many of our hospitals have been, the 12 acute care that Jay talked about, have been around for more than 100 years. And we came together, we'll actually celebrate 3 years, November 1 as Presence Health. We were the merger of Prevena Healthcare and Resurrection Healthcare. I say 2 proud, tough Catholic systems that thought if we came together, we could be something bigger and better. 4 of those hospitals of the 12 are right here in Chicago. St. Joe's on Lakeview, St. Mary's and Elizabeth's over on Division, Resurrection Medical Center on Talcott. But we have hospitals in Elgin, Aurora, Evanston, Joliet, Kankakee, Danville, and Urbana. So we're covering a large part of the suburbs of Illinois. And as Jay said, we're not only the second largest health system, we're the largest Catholic system in the state. We talked about the hospitals. We have home care, hundreds of physician offices, and we're proud that we have one of the largest behavioral health networks in the state, and proud to support and want to support the Kennedy Forum as it brings behavioral health issues to the forefront. So thanks for the leadership on that. Presence has $2.5 billion in annual net revenues, and we give back to the community. You'll see on your tables over over $500 million in charity care and community programs. We're really proud, and a lot of people don't know that we have a small but kickin' university, Resurrection University, located over on the St. Mary's and Elizabeth's campus. Thankfully, because of the city of Chicago, we got TIF funding to do that. They've doubled their enrollment. They have over 500 students now. They graduate baccalaureate nurses, advanced practice nurses, and we're proud to brag about the fact they have one of the highest pass rates for the nursing boards of any university in the state. We're also one of the largest graduate medical ed programs in Illinois, another well-kept secret. over 300 medical residents train as resurrection medical residents in the state of Illinois with us. And 80% of those physicians are primary care doctors, OB, family practice, internal medicine. So doing our part to really train the next generation of caregivers. We have 21,000 employees. We have over 4,000 doctors associated with Presence Health. And these men and women, I'm here to tell you today, they put their lives at risk. They put families at risk to come into work every day, particularly at a time that the country is looking at the Ebola crisis. And you may say, well, isn't that their job? And it is. But we have men and women standing up, volunteering to take care of an Ebola patient, knowing that they're putting themselves at risk, knowing they'll be quarantined at home for 21 days, but they care that much about keeping the community safe and for the work that they were called to do. So I'm very honored to work with 21,000 people who are out there willing to step up and make this community safe. Presence Health, along with many other providers, Jay and others across the city, state, national level, we've been working around the clock to make sure that we're ready for the unlikely event that we'll have an Ebola case. The city has designated 4 what we're calling resource centers, and you know these: Rush, Northwestern, University of Chicago, and Lurie Children's. Those are the centers where if someone were definitively diagnosed as an Ebola patient, the patient would be taken to be treated. But every healthcare facility in this state and in this city has to be prepared to diagnose and to screen for Ebola patients. And that requires the same level of preparation, gowning up by our employees. I asked, you guys see all the pictures on TV with everything on? What do you think that costs for one? $600. Okay, so the cost we just ordered this week, $150,000 in additional supplies to gear up every single one of our hustles to make sure we have the protective personal equipment for our staff. You can be assured, I think the city's ready. I know Presence Health is ready. I know Jay's ready. We're going to play our part. We feel very lucky that we have university hospitals that can also help with the treatment. So today, I want to organize my remarks around really just 2 questions for you. One is, what is the fundamental change in healthcare that is needed, and what will it look like? Why is it needed, and what will it look like? And I've actually brought some things to help me. I have a few little gadgets and things I want to share with you today. But the first question is, why does it need to change? And it's pretty simple. And I don't know if you would answer this the same as I would, but it's healthcare cost. We cannot, in this country, afford the trajectory of cost that we have been on. It's threatening the country's overall economy. It's impacting negatively individuals, families, and businesses. Federal budgets, state budgets, crushed by the cost of government-sponsored health programs, such as Medicare and Medicaid. And you probably know this, but per capita, we spend more in the US on health care, per capita, per person, than any other industrialized country, and yet don't have better results. In fact, we kind of travel in the middle of the pack, and in some cases, our results are worse, even though we might be spending 4, 5, 10 times more per person. Before the Affordable Care Act was passed, 45 million Americans were without any kind of coverage. I'm really pleased that in Illinois, as a result of the Affordable Care Act, 217,000 people have been able to acquire insurance coverage through the marketplace exchanges, where they get some support on the premiums. Also, this state expanded Medicaid, and another 425,000 people last year were eligible for Medicaid. Now that says a lot. We're covering those people with a Medicaid card for Illinois, but those are also people below 138% of the poverty level. So it says two things about it. So we've got a growing group of people at poverty levels that are making them eligible for Medicaid. So one of the things we have to work on is not only getting them coverage, but changing that economic status. But here's an irrefutable fact. The US spends more on health care. The quality of care and the outcomes are in the middle of the pack or lower than other industrialized nations. Something's got to change. So I'm going to offer some opinions on what that change ought to look like. So my team has helped me. So on this hand, I've got a pair of running shoes. In this hand, I'm holding a stent. Does anybody know what a stent is? A stent that could go in a cardiac vessel to increase blood flow to the heart after a heart attack. I guess we put stents in other places in the body, but generally to increase the blood flow. $60 over here, $30,000 a case when we do a cardiac procedure where we put a stent in. Do 700,000 procedures a year in the United States, costing $14 billion. Would we be better off potentially working on more running shoes and using them? The thing that we believe is that we need to get into the gym a little more. We need to look at our diets. We'd all be healthier, a little bit of prevention. Meaningful reduction in what this country spends on health care is not going to be done on the margins anymore. We have already taken waste out of the healthcare system. We have already reduced our operating costs. We merge with other systems to reduce overhead, to get better prices in the supply chain world. The change has to be much more fundamental than hospitals buying more efficiently on the products that they use. We all need to put the gym shoes on more, trim our waistlines and our national health care spending. And perhaps the nation's gym shoe expenditure ought to be greater than what we're spending on coronary stents. So a new paradigm is emerging, and it's driven by the Affordable Care Act. Think of these words, because you've probably read about them in the paper. It's called Population Health Management, Pop Health, we call it. In simple terms, it means the bringing together of all the necessary pieces to keep people or a population healthy. Population health redefines health care beyond sick care, and it's moving it to wellness and prevention. As an industry, we have done a great job for you when you are sick. But what have we been doing to try to keep you well? And I know there are a lot of things that determine a person's health. Some of it is medical care, but some of it's genetics. And much of it is behaviors, diet, exercise, social issues, and environmental factors. And I was reminded today with Sister Claire Francis at the table. A couple of years ago, she sent me a video. I think Bill Moyers had done a TV show on the number of healthcare problems that we treat due to our diet. Really, it's what we're putting in our mouths, or smoking, alcohol, and not enough exercise. It was really a phenomenal show about how we could alter people's health and the cost of healthcare by merely changing some of these habits. So now we've got to look at the whole person, not just his or her medical history. And that will cause we, the hospitals, to transform the way we deliver healthcare today. We haven't been economically structured nor incentivized on the gym shoe spending side. It's the stents, man. We're all looking to put in stents. We get a fee for service every time somebody comes in who needs a cardiac procedure, because our economic systems in healthcare have rewarded us doing those procedures, not buying a pair of Nikes for Jay or Ed. You need them, man? You need a pair of Nikes? The Affordable Care Act is driving new payment models through organizations that are called ACOs, or Accountable Care Organizations. Focus on the word accountable, meaning you gotta stand up and be counted for the results that you're getting. And these models are gonna put greater financial risk on health systems to keep the population healthy, instead of what we call being paid for heads in beds. I've spent my whole career putting heads in beds. You build a new tower and the board says, how many of those beds you got filled, Sandy? What do you mean you got 100 empty beds? You got to fill those beds. To a new economic model where we're going to be paid to keep people healthy. And if we're actually successful, there won't be as many heads in the beds. And this shift is giving doctors and hospitals a direct financial stake in saving money and a reason to invest in some of these programs that will keep people healthy. The question is how to provide access to primary care and preventive services. It's a critical question. And the new model is moving us through population health beyond the walls of a hospital and beyond traditional medical treatment. We got to look at where healthcare begins, at home, in the communities, in our schools, where we work, where we play. We need to know more about secure housing, opportunities for employment, access to healthy food, safe streets. As healthcare providers, we got to know now whether that patient has transportation for the services we're recommending, or whether that patient can afford the prescription that we're prescribing. If they did have a pair of Nikes, do they have a place to exercise safely? Can they run in the streets? If we can't provide some of those services directly as Presence Health, then we have to build partnerships and coalitions in the community. I'm told to say this, so I'm going to say it. In a few days, we're going to be announcing an exciting new partnership that will help us do just that. I cannot tell you anything about that partnership. I even said, what is it? No, I know what it is. Okay. So you'll just have to wait and stay tuned. But we know as Presence Health, we cannot provide everything that's going to be instrumental to keeping people healthy. So what I'm talking about is how do we drive value in the health system, a system that has greater value, lower costs, something everyone can agree on. Pop health. A lot of people think it's the government takeover of healthcare. I don't believe it is. It's a new model. It's based on competition and free enterprise. And here's an important distinction. We're changing what we're competing on. In the past, we competed on volume. We competed on how to shift costs from one payer to the other. The model we're moving to is a competition around value, lower costs, better outcomes, better experience, and a healthy population. And a great way of thinking about that, Presence Health has new outpatient care capabilities. We follow more than 2,000 Medicare patients who have chronic conditions like diabetes, high blood pressure, heart failure. And those care managers call those patients frequently on different schedules. We recently talked to an 87-year-old patient who said he wouldn't have made it after surgery had it not been for the outpatient care managers following up with him, keeping him on track, making sure he had his meds. And with this program, those 2,000 Medicare patients who are among the sickest that we have the fewest ED visits, have the fewest rehospitalizations, because we're delivering care in a different way outside of the setting. So I have another little aid here. I have my smartphone. Y'all have phones? What's a smartphone a symbol of? It's a symbol of, we think, the transformative technology to change everything in healthcare, just as it's changed everything else we do. For us in healthcare, technology means electronic health records. Electronic records that allow the physicians to communicate better, help health systems operate more efficiently, and allow you, the consumer, to get access to your records right through your phone. How many of you have done that? Okay, great. We now have these electronic medical records, and you should have an app on your phone that lets you go to your records if you want to. Technology also means telehealth. Telehealth meaning it doesn't matter what the distance is, we can still deliver care. We have a great example of this. We have a comprehensive electronic ICU, or tele-ICU. We provide care coverage to 289 critical care beds across all of Presence Health 24/7 every day. We have doctors and nurses in a center with electronic means and a screen monitoring all of those beds, able to visually see the patient, to be able to see with such clarity they can read what's hanging in the IV bag. And they've cut medication errors by being able from the electronic center to see that we've hung something that wasn't ordered or appropriate. Tele-ICU is staffed 24/7 and works hand in hand with the clinicians at the bedside. The same is true in our neuroscience area. We're taking telehealth, and in smaller hospitals that don't have all the medical resources, they get a patient in the ED, a physician from another one of our centers can do an evaluation and tell what might be going on with that patient. It's really important in the case of stroke. We recently had a 37-year-old patient suffered a very rare stroke while walking out of a local coffee shop. And this technology made the difference in potentially life and death, but for sure for the rest of his life. It was diagnosed via telehealth that he was having a stroke. They started the clot-busting drugs, as someone called it, the Drano drug, that kind of opens up everything. Shipped that patient to Resurrection Medical Center over on Talcott, where they were able to go in and remove the clot. 3 months later, he's walking, he's talking, he's back to work. He has no residuals from that stroke. That's telehealth providing access and better care. That's on the sickness side. We have to talk about how to use technology to help people stay healthier. And we're beginning to see wearable technology. How many of you have your Fitbits or your Jawbones? Russ, did you have yours? I don't see it being waved over there. We have so many ways now to help, where most of us are kind of obsessed with getting our 10,000 steps in. And those 10,000 steps are important to us from a fitness perspective. But think about the new apps that are coming out can actually transmit the data here right into your electronic medical record, where your care provider will know whether Ed's taking his 10,000 steps or Jay's sleeping well or whatever it is that you're monitoring on your Jawbone or Fitbit. So we're trying to find ways to use technology to help keep people healthy, but it's also, my phone, symbolic of something else. I think it represents access, knowledge, convenience, and consumer empowerment. Every other industry in our society seems to have figured out how to utilize mobile technology better than healthcare. And we all make our dinner reservations on Open Table, and we make our airline reservations, and we pay our bills electronically. But have you ever tried to make a doctor's appointment on here? Or pay your medical bill on here? Now we're getting so we can do a little bit of that. Can you find out what are the best hospitals in Chicago? Who's got the best infection control rate? Which doctors have done the most of some kind of surgery? No. We haven't yet in healthcare used the technology to really simplify and help you get access. So just last night I heard a presentation on an Uber app for healthcare. So think about an Uber app where the closest care provider that meets your criteria, I don't know if they'll be in little white coats instead of the little cars that go on Uber, but we have a ways to go in healthcare, but now what's happening is we're kind of being shell-shocked by the number of technologies out there and which are the most appropriate to deploy, particularly from a health and wellness perspective. Now, I have one more thing. I promised you in the talk that I would talk about the future, the redefining of the Blue H. Anybody here have all seen a Blue H somewhere? On the highways, in your communities? The H has always directed us to the right highway exit, to the right neighborhood, to the right street, and we get to our doctors, we get to our hospitals, especially in an emergency, a critical component. I think the most monumental shift going on in the current healthcare model is that hospitals will serve and have to serve a different purpose in the future than we are doing today. The focus and the incentives to keep people well mean every hospital and every community may not need to provide every service. Under the new model, the reality is we probably have too many hospital beds in Illinois and in Chicago. The future of healthcare is about more primary care, more immediate care centers, more neighborhood clinics. It's about being able to get and access care electronically. It's about being able to get your care at home. It's about having more virtual care centers to help people diagnose. And if you don't believe me, the shift has started to happen. Hospital admission rates for Chicago, Cook County, and the state of Illinois have dropped by 9% over the last several years. More than double the rate, actually, of the national sample from which it was compared. Don't go out of here thinking that Sandra Bruce has said hospitals are going to disappear. I don't think they will. I think hospitals will always be needed to provide that very highest level of acute care. But I am saying that the role hospitals play will be very different. Because if we're doing our job of keeping people healthy, we are not going to need all the brick and mortar. Some of the hospitals won't be able to make the shift. Some of the hospitals may not survive. The blue H in the future might well be the symbol on your smartphone that gets you to a primary care center or a diabetes management place or just to a primary care provider. Maybe it'll get you to chatting virtually with your doctor about the progress you're making on reducing your cholesterol. The shoe, the stent, my phone, the blue H. These are symbols to me of the disruptive change going on in healthcare. This isn't about change this time on the margins. It's about a profound, transformative change. Presence Health is focused on that change, and our board set some principles for us to lead the change. They said, first of all, the consumer is primary. I know you guys are shocked by that. You think that we should have figured this out a long time ago. We actually thought we had. We thought by being really efficient and feeding you at 4 o'clock in the morning and interrupting your sleep all night long was a very efficient way to deliver health care. It wasn't exactly what you were looking for in terms of the experience. We're learning. We're learning that value, not volume, ought to be what we're competing on. One of our principles is that technology should be doing for healthcare what it's done for other parts of society, getting convenience, ease of access, and we're working on it. And the hospitals that we have will need to look and operate differently in the future with a new focus on health and wellness and not just on sickness. I think the blue H is going to transform from hospital to meaning health. So when you see that blue H, you can expect a different range of services over the next few years than just strictly hospital care. I'm optimistic about the future of healthcare in our city and in our state. And I'm optimistic about Presence Health that we have great people. We have committed staff, our doctors, our nurses, our clinicians, support staff, our volunteer boards. They want to heal. They want to help our communities live happier, healthier lives. And they'd like to see nothing more than an entire country harness innovation and creativity and bring better health to everyone. So when I talk about redefining that blue H, it's really about the journey that Presence Health has been on since we formed 3 years ago. We're at the forefront of the transformation. We're well positioned for the future because fundamentally, the journey is about doing what's right for our communities and placing the consumer at the center of healthcare. Presence Health, our sponsors, our board, our leadership and our staff are committed to leading this transformation, and we're looking forward to doing it with so many of you in this room, our partners that will ensure that Chicago, our surrounding communities, the state of Illinois is the healthiest and best that it can be. Thanks for letting me be here.
I told her she's not even running for office. Maybe she wasn't. The applause may not be that great. However, I do have to suggest that we at City Club and Maggiano's are doing our best to give light food, and we're there trying to recruit for you. Okay. Do we have our people here? Yes, we have questions. Raise your hand. We have a time for a couple of questions. Here we go. Person didn't sign their name, just to say. We break the rules since it's the only question we have. Why not? Ed, is it okay if we do that?
Got my information.
That's all I need to know. Will Presence Facilities find a way to provide? It's not your handwriting, Sharon, but this is your question. Will you find a way to provide contraception to women and employees who want and need, especially low-income people? It's all your fault. See, by the way, sandbagging is part of what makes us famous.
Okay, good. I'm wondering if we could wait till February when the new Archbishop is here to give his remarks and pose that question to him. I think that would be really helpful. But let me respond to it because we run a Catholic health system. We live in one of the most Catholic cities, states in the country. Yeah, we do. We have worked out relationships with the sponsors and with the church to make sure that all women have access to where they need to be if they are seeking contraceptive care or tubal ligations. We don't directly provide it, but our providers are able to make sure that those services are arranged throughout the city in a way that our people have access. It's absolutely critical. Medicaid, we're going to be in the ACE, okay? We're going to take Medicaid managed care. One of the requirements of taking those dollars is that women have access to all of those services. So we have partners in the ACE. We don't directly provide it, but they have access to those other partners.
With an answer like that, she could run for office. Okay. Well, I don't see any more questions. You haven't written it out, huh? Naturally. Stand up and say who you are and what's your question.
My name is Mark Duprinsky from Harvard Heights, Illinois. Resurrection Hospital and Talcott services our community. What you said, how do you envision the change in approaching newer generation, younger generations, especially since we're so encompassed on the type of foods that we eat that are typically unhealthy? How do you see that approach? Because preventive medicine and talking about staying healthy has been talked about for at least the past several decades, but nothing has truly changed, as you mentioned yourself. Other countries, European countries where I have relatives, I can see for a fact that keeping a person healthy is of utmost importance. And somehow here, we treat people when they get sick. What will you do differently?
Yeah, well, that's an excellent question because, as I said, the healthcare system, we've been very focused on sick care, okay? If you get sick, we take great care of you, but haven't really focused on wellness. And partially that's been an economic issue. Just being straight up, we followed the dollars. You get paid for people in ICU, you get paid for a cap. You know, there's been no economic incentive to really focus on the wellness side. The Affordable Care Act has really changed that. It's saying you have to take accountability for the care of that patient. You're going to be penalized if they don't get well. You're going to be penalized financially, sometimes on a financial basis. We'll take capitation. So let's pick Sister Clara Francis and Tom Coffey here. I get $1,000 a month, say, for taking care of them. The first thing I want to know is, are you smoking? Does Tom have a pair of tennis shoes? Is Sister eating right? Because I'm now economically incentivized. I've only got this much money to spend in the budget for their care. I have a new motivation. I'm sorry to say, but that is influencing how healthcare in this country is going to change. The economic incentives have changed.
Okay. One last question, and since no one has written a question with their name on it, what the heck? Yes, state your name, your real name, and your question.
In regard to your talk today about,
Little
I
louder.
can't hear him.
in regard to your talk today about the symbols and your theme of wellness, can you just talk a little bit about the exciting project of your ACE to the
Can you repeat it for me? I didn't hear the question.
Talking about your ace.
The eighth?
Yeah, not the king or the queen, the ace.
Yeah. So the Medicaid ACE, is that the question?
Yes.
Okay, so the Medicaid ACE, as you know, the state of Illinois is mandated by January of 2016. Half of the enrollees in the state Medicaid program will be required to be in a managed care product, in a capitated product of some kind, not necessarily with us. Then the state went on to say, and Sarah can help us, in order to ensure that we achieve that goal, we're going to mandate 100% of the Medicaid recipients in certain counties, including every county in which Presence operates. So all of our Medicaid patients, consumers, will be in a Medicaid managed care product by January of 16. So Presence Health said, hey, we're going to step up. We'd like to be a Medicaid ACE, Accountable Care Entity, that's the state's name. We will be planning to take capitation, we believe, January of 16. And in order to take risk for those lives, this keeps our board chair up at night, is how do we manage the health of the Medicaid population? There, the issues become transportation. The issues do become healthy environments sometimes. Now, not all Medicaid populations are the same. So we have to look at block by block, community by community, what is the environment in which our Medicaid patients are going to live, and what social interventions do we need to make. And this is where we're going to need so many community partners. We cannot do this alone. Public health departments, various community agencies from the Y will play a big role in managing the health of that particular population.
No, you have your own tennis shoes.